Good afternoon. My name is Parmeshwaran Iyer. I am the Secretary in the Ministry of Drinking Water and Sanitation in the Government of India, based in Delhi. And today I'm going to be talking about the Swachh Bharat Mission, India's sanitation revolution. Now, we believe that this is perhaps the biggest behavior change program ever attempted. Just look at the numbers. When this program was formally launched in October 2014, there were about 550 million people in rural India who practiced open defecation. Today, 3.5 years later, that number has come down by about 300 million, down to 250. Still a big number, still a way to go, but we have made a lot of progress. And as you can see, the program was formally launched in October 14, and the Prime Minister has given us a deadline of 2nd October 2019, which is important for us because it's also the 150th birth anniversary of Mahatma Gandhi, another great proponent of sanitation. So the Swachh Bharat Mission has got many good reasons to come into existence. We have put 2 or 3 of them here, although most of us understand this already. One, of course, is that sanitation saves lives. And UNICEF has told us that diarrhea alone kills over 100,000 children in India. If you look at the impact of sanitation on nutrition as well and childhood stunting, it's another good reason for the Swachh Bharat Mission. About 40% of India's children are stunted, leading to a potentially less productive workforce. So again, very important to focus on sanitation, but also economic productivity. A World Bank study had shown that at a macro level, the lack of sanitation costs India over 6% of GDP. And so another good reason to do the Swachh Bharat Mission. Women's security and dignity, particularly in rural India, a major issue, and open defecation is a threat to that safety and dignity. So another very good reason to undertake the Swachh Bharat Mission. And a major departure from previous programs was the Prime Minister announcing a sunset clause, as I said, to achieve an ODF and clean India by 2nd October. So this 5-year time frame has given a sense of urgency and purpose to this whole program. I wanted to share with you the idea of what we call a BHAG, a big, hairy, audacious goal. This is management jargon coined by Jim Collins, but it's also to mention that the Swachh Bharat Mission is a very big idea by itself. If you compare it with John Kennedy's announcement in 1961 that America would put a man on the moon, and he said it would be done by the end of the decade. It took them 8 years. Our Prime Minister, in August 15, when he announced the program, said that this program, changing the habits of 1.25 billion people, would happen by 2nd October 19 in 5 years. We are well on track, and we think that the Swachh Bharat Mission is a much bigger bhag than putting a man on the moon. So how is this program unique? As you can see from the left, there's a whole history of rural sanitation in India, starting from 1986 onwards, with different names. The Swachh Bharat Mission was launched in October 2014. So how is this so different from previous programs? The first, and I think the biggest game-changing difference, is that the Prime Minister of India, the Chief Executive of the country, is personally championing a sanitation mission, so that is political will at the highest level. This has never ever happened before in India. The second is behavior change and usage of toilets are at the heart of the program. Supply follows demand, but this is all about shifting and changing behavior from open defecation to open defecation free. And how is that to be done? That's the major challenge. That's how we are getting into community-led total sanitation. There's a policy shift from output to outcome. So it's not just counting the number of toilets built like in previous programs, but moving to open defecation free. So the concept is how a village community collectively accepts responsibility and is accountable for making itself ODF. So there's peer pressure, and I think that collective, that community mobilization, that's at the heart of this program. A lot of focus on verification and sustainability to make sure the numbers are good and the ODF is sustained. This program differs from earlier programs in a big way by this extensive focus on verification and sustainability. It's a people's movement. what the Prime Minister calls a Jan Andolan in Hindi, which means it's a people's movement and it's everyone's business. It's not just our ministry or departments in state government. The commitment is backed by public financing. So there's a budget of over $25 billion shared by the center and states for sanitation, including solid and liquid waste management over 5 years. That's a lot of money, but the government is backing its commitment with the finances. Now you can see from this at a glance of how the sanitation coverage in India has accelerated over the last 3.5 years. So from 81 to 2014, it was a gradual increase. So the coverage was about 39% in 2014, and today it's doubled. It's about 79%. 325,000 villages and 314 districts in India have been declared ODF. It's a huge number. 9 states or provinces have become ODF. 3 union territories. We expect about 15 union territories and states to become ODF by the end of this month. And we're well on track to achieve an ODF India by December 18. Again, these two maps give you at a glance the progress we have made over the last 3.5 years in an unprecedented scale. So coverage when the program started was about 39%. You can see that there were many states in India which are pale yellow or even brown. And if you look at the map on the right, where we are today, coverage is about 79%, and most of it is green, and you only have 3 or 4 states which are the same color as they were in 2014. But equally or even more important are the usage number. So we do these large sample surveys through third party, one of them by the Quality Council of India, an independent agency in 2017, established that 91% usage was there in India of the toilets built. And the National Sample Survey Organization in 2016 estimated that about 95% of usage was there of the toilets built. So that's giving us the confidence that, this is behavior change is actually working when people are starting to use their toilets. The verification and sustainability focus is very, very important for us. And a lot of people will ask us questions about the numbers and how accurate they are and how do we verify. There are actually multiple verifications after a village gets declared as ODF. So first of all, after some due diligence by themselves, in an open meeting, they will democratically declare themselves ODF. A Gram Sabha is a public meeting of all the villagers. Within 3 months, there has to be a third-party inter-district verification by an outside agency. And that's 100% verification of all households in that village. And then 6 months later, there's a sustainability verification that the village which was verified as ODF continues to be ODF 6 months on. Third-party verifications, as I mentioned, Quality Council of India, there's an independent verification agency under the World Bank project, which is currently doing a 90,000 household survey. We send out national level monitors from Delhi to the field, and then the NSSO. Sustainability, a major focus for us. How do we ensure that ODF is sustained? Unlike previous programs, detailed guidelines have been issued, protocols have been issued. We are trying to incentivize states, districts, villages to remain ODF. IEC funds have been earmarked for sustainability. Are the mechanisms in place institutionally at the village level? Are the watch and ward committees still there? How do we incentivize the state governments to sustain these institutional structures, to sustain ODF? Major focus. We want to make sure that whatever gains have been achieved remain that way for a long time. This program is all about communication. As we know, whether we call it IEC or whether we call it behavior change communication, we have different terms. Ultimately, it's about communicating the message. Why is sanitation important? Why is it good for the health of your kids? Why is it good for the dignity of women, etc.? So we look at this in 2 different ways. We have got above the line communication and below the line communication. Above the line is mass media, newspapers, TV, radio, outdoor. We have Amitabh Bachchan, many of you would have heard of him, who is doing a major campaign called Darwaza Band, and you can see that on the right. And basically that means shut the door on open defecation, targeted mainly at men. And then we have got below the line, which for us is perhaps the most important communication. On the right, you can see a group of kids. They are part of what is known as the Nigrani Samiti, which goes out early morning to make sure people don't defecate. But the triggering through community approaches to sanitation is critical. This is that interpersonal that person-to-person communication, which is completely irreplaceable. And at least one Swachhagrahi. A Swachhagrahi is a grassroots level motivator who is trained and given an incentive for making a village ODF and for it to be sustained as ODF. So we have about 400,000 of these grassroots motivators all over India. And the idea is to have at least one in each village. There are about 650,000 villages in India. So we have 400,000 already, and we will hopefully soon be getting one in each village. So this is all about how can that communication take place on the ground. It's led by the Swachhagrahi, but there are wall paintings, street plays, Swachhata Raths are mobile platforms. So triggering and Nigrani Samitis, this is at the heart of the program. That person-to-person communication to convince people for the importance of having a toilet and then using it. Another model for us in the Indian model on Swachh Bharat is how to make sanitation everyone's business. And so we have what we call horizontal activities. The Swachhata Action Plan is all ministries in the government of India have to mainstream sanitation into their ministry's core programs. In this financial year of 17-18, already over $2 billion have been collected by their own budgets, and how they are mainstreaming sanitation into transport, into agriculture, even into defense. Swachh Iconic Places is cleaning off some iconic places in India, including the Taj Mahal, to benchmark them to an international standard. The Swachhagrahi, as I mentioned, 4 lakh is 400,000 registered grassroots motivators. This is our foot soldiers who are going and spreading the word. The Swachhata Pakhwada is again all ministries in the government of India, and now hopefully in the states as well, will be focusing on sanitation for one fortnight a year, so that year-round there is a buzz around sanitation and activities around sanitation. Young professionals, the Zilla Swachh Bharat Preraks, a major contribution made by the Tata Trust, where we have these young professionals in the districts who are spending a year of their lives focusing only on Swachh Bharat and sanitation and supporting the district collectors. So they are the eyes and ears of district officials. They give us feedback in the government of India and playing a very important role in the acceleration of sanitation. And the Swachh Bharat course is a platform for private sector and corporates to contribute to the Swachh Bharat mission, and they can dedicate their funds to any particular aspect of sanitation they are interested in. So we do a lot of special initiatives around the year. Typically, we will invite the Honorable Prime Minister, who joins us for most of these events. So this one, which was done last year between September 15th and 2nd October, was called Swachhata Hi Seva, which means sanitation is itself service. And this was led by the Prime Minister. You can see a picture of the Prime Minister himself contributing to labor. That's the completion of the honeycombing of one of the 2 pits in Varanasi in India. And there's an unprecedented mobilization. Over 90 million participated over this fortnight. We had union ministers, members of parliament, celebrities, NGOs, youth, citizens, school kids, and millions got access to sanitation services during the period. So these kinds of campaigns are very important to keep the momentum going, to accelerate the program, and to remind everyone that we have a deadline to keep, and therefore we need to get a move on. School children's important involvement is critical in Swachh Bharat. And so school sanitation, we get a lot of support from UNICEF and other partners on this. And this particular initiative was getting school kids in primary schools to do paintings on sanitation. So you can see one painting by a child in a hill state of Uttarakhand in class 11. So 30 million essays, 30 million paintings, 300,000 short films. Some very big numbers show the mobilization, again a part of IEC, how to get people involved and committed to sanitation. And a very touching letter we put on the screen from a young girl in 6th class in the state of UP. She's writing to her father, requesting for a toilet, saying it's embarrassing to defecate in the open. And in fact, I insist that you do this. So quite touching, but quite effective as well. How to use school children to promote sanitation and influence their parents and their communities to become open defecation free. The impact already created by the Swachh Bharat Mission. You can see 2 charts on the screen. On the left, a very useful study done by UNICEF about 6 months ago, essentially to show that an ODF village enables a household in that ODF village to save up to 50,000 rupees, which is about between $800 and $900 a year, just because the village has become open defecation free. And that saving comes from medical costs averted, time savings, real estate value going up, etc. But it's quite an important realization. There's already this impact of Swachh Bharat and of ODF, and it can also be used as a marketing tool to convince people to make their villages open defecation free. On the right, you can see the results of a study done by the Gates Foundation for us, looking at the health impact of sanitation. Something we all intuitively know, but we thought we would do it scientifically. And you can see from this study carried out by the Gates Foundation that the incidence of diarrhea, stunting, wasting, and low BMI in women were all significantly lower in ODF villages compared to non-ODF villages. Again, the impact is clear, but it's also making the case for sanitation. Some key focus areas going forward. We've still got a lot of work to do. And so focusing on verification and sustainability of all ODF declared villages. We need to enhance our IEC and behavior change campaigns, even in the ODF declared districts and states, because we want to make sure that the ODF is sustained. Scale up capacity building further. We have a number of initiatives to scale up capacity building, ranging from virtual classrooms to knowledge portals, but most importantly, the trained motivator, the Swachhagrahi in every village of India. And we have about 400,000 of them already. How can we scale it up? How can we improve the quality? How can we retrain them? All this is being worked upon. And then sharing of lessons and experiences from across India, but also learning from abroad. So we encourage cross visits within India, workshops. We get district collectors together. There's a learning portal. And of course, the preraks, the young professionals in the field, we use them as a tool and platform to effectively share lessons across India. Solid and liquid waste management, another very important element of Swachh Bharat, particularly in ODF villages. It also motivates them to remain ODF when they do what we call ODF plus, which is talking about solid and liquid waste management in villages. And there's a lot of focus on this, whether it's plastic management, whether it's grey water management, whether it's cattle waste. So all this is part of the Swachh Bharat program, which is now being integrated along with the focus on ODF. And finally, some big lessons we have learned along the way in the last 3.5 years. So I thought I would share some of them with you. We've learned many more lessons. The first and foremost is obvious. And, we are fortunate we have that in India. Political support from the highest level. A huge difference. The Prime Minister of India, this is his flagship program, and that is communicated down the line from a chief minister of a province to the district collector all the way down to the village chief. So everyone understands that. So there's alignment along the way. And of course, we are also fortunate that our Prime Minister happens to be our communicator in chief as well. He never misses an opportunity to talk about the program and its importance. So political support is critical. Think scale, not drip. We have no option, of course, in India. We have to think scale or we wouldn't get anywhere near our goal or deadline. But it's important not to think incrementally. And so we learned that very early. Change must come fast. It's got to be done in mission mode. We don't want to sacrifice quality for quantity, but we have to think big and we got to think scale. So whatever we do, we always think of scale. We don't think of pilots anymore. Whatever piloting we had to do, we did very early in the program. So don't think drip, think scale. Engagement with implementers. This has been one of the most important lessons we have learned right from the beginning. We are a federal country and water and sanitation are subjects which are the mandate of provinces. So how do we incentivize them? We have a continuous dialogue and close engagement with states. I must have traveled over 100 times in the last 2 years to various states and districts. My entire team travels. We meet chief ministers, chief secretaries, district collectors. We have video conferences. We have ODF Saturdays where we have video conferences with collectors and below. This engagement to keep up the pressure, to keep up the motivation, to make sure that they are taking a program, it's on the top of their priority list. This continuous engagement, which keeps us busy 7 days a week throughout the year, is absolutely fundamental to the success of this program. And getting everyone involved. So making sanitation everyone's business, all stakeholders, private sector, public sector, NGOs, schools, the religious communities across the board. How do we do that? How do we promote that? How do we facilitate that? It's important now. If you ask anyone in India, everyone's heard of Swachh Bharat. Everyone's got a view on it. But so that's been one of the biggest successes of this program. Its recall value is very high and everyone wants to be involved. And then, of course, success breeds success. So you need to get some early wins. And, again, you focus on the low-hanging fruits in the beginning to make sure that, we get success. But at the same time, it's very, very important to inspire the laggards, because there are some states and districts which have very low coverage for different socio-economic reasons. So we don't want to neglect those. So we have 2 or 3 parallel tracks. We try to get some quick wins, but we also in parallel focus on the high-hanging states and districts, if you like, to make sure that ultimately, when we are achieving our goal, everyone is almost on the same level. And then competition and housekeeping. We encourage healthy competition among states, among districts. As I mentioned, we are a federal country, and it's important that there is some level of healthy competition. So we announce awards, rewards, recognition. Prime Minister gives awards at least a couple of times a year. So everyone is competing. At the same time, it's a healthy competition. It's all transparent. There's a portal which tells you how you're doing. And at the same time, while we are accelerating, we need to ensure housekeeping. So is the verification happening? Are the toilets being geotagged? A lot of housekeeping needs to continue. We learned from the beginning, or it'll be too late in the end, or it'll be too much of effort to do housekeeping when you've achieved all the results. So competing and housekeeping. And finally, just to go back to where it all began, the father of our nation, Mahatma Gandhi, who 70 years ago, before we became independent, said sanitation is more important than political freedom. So that is also the inspiration for our Prime Minister in setting this deadline of 2nd October 2019, the 150th birth anniversary of Mahatma Gandhi. So I hope some of these lessons will be useful to you. We'll be very happy to follow up if you have any further questions or suggestions. Thank you very much.